Okay, so we just had to stop and take a break because, as any good home health or hospice nurse knows, at some point during the day, just to keep your sanity, you gotta stop and take a break. So, my favorite stop and take a break place is Starbucks. And I'm trying something new today. This is a seriously strawberry frappuccino. Let's see. It is seriously good. Yeah. hmm On this 95-degree day, this is a great little perk me up. So, one of the things I was going to talk to you guys about, I'm going to get out of the way. I'm going to pull off over here, out of the way of traffic, is your Medicare benefits. Because if you are on Medicare, you one of the benefits you have is for hospice care. And so if you're not using it due to fear of the word hospice, you're cheating yourself. So you've paid in for that benefit, and that's not fair to you just because the word hospice is scary to you. And that's understandable. Uh, the word hospice is a scary word, but it doesn't mean that you're dying. It means that you have a terminal illness with a prognosis of 6 months or less if the disease runs its normal course. And I don't think I touched on that before. So um, I have had patients that far outlived their prognosis. I think the longest I've ever had a patient was 2 years, maybe a little over 2 years. That was a long time ago. But what we do after that 6 months, then in 3 month increments, you have to be recertified. So we have to prove to the insurance or Medicare, and Medicare sets the standard for private insurance. So we have to prove to them that you are still eligible for your hospice benefit. And usually, what would happen with my lady that I had for so long, which I got really attached to, and we'll call her Miss W. Something would happen every time I would think, okay, we're going to graduate you out, Miss W, it's time. Um, and something would happen inevitably every single time. She would fall, or she'd get an infection, um, and it was just always something. And I did actually graduate her out once, I believe. And what happens is you graduate them out because we get them feeling so good, and they graduate out, and then they get sick again because they go back to not taking care of themselves, or they go back on all the medications, and the medications make them feel bad or make them susceptible to getting sick again, which is a whole other topic that we'll talk about at a later time. One of the things that is a myth with hospice is that we come in and take you off all of your medications and tell you you can't take this, or you can't take that, or you have to do this, or you have to do that. All we do is make suggestions. And one of those suggestions is that you do stop a lot of medications. Um, One that pops to my mind immediately is cholesterol medication. If you have a prognosis of 6 months or less, cholesterol medication is not important. Cholesterol medications have a lot of side effects. Look them up. I had a surgeon tell me one time that if I could see the liver of what a patient looks like on the table that has been taking cholesterol medication, I would stop. what I was taking. And I'm not even going to mention what I take. I have a hereditary problem with cholesterol. I'm overweight. I don't work out like I should. But even when I was thin and working out every day and at the top of my game, my cholesterol was still way above where it should be. My dad's was that way. It's a hereditary thing. So it's my choice to continue to take that medication. But if I had a doctor tell me that I could possibly die within 6 months, that would be one of the first things that I would stop. And I'm trying to, this hair today, y'all, is just, oh my goodness. I cut my own bangs. Okay, sidetrack. Squirrel! Okay, anyway. But we stop or suggest that you stop a lot of medications and all of those side effects that were going on with those medications go away and you feel better. So you start feeling better and getting more active and doing things and you think I'm cured. So that does happen a lot. And then they get graduated out, they live longer. And look at the studies, particularly heart disease and lung diseases like COPD and emphysema. Once they go on hospice, they live longer, up to 3 months, I believe is what the most recent study showed. My personal belief, because scientists can't really explain it, my belief is we stop a lot of those medications. Not going to get into a debate about big pharma, but there are medications that are useful and there are medications that are money makers. Just saying. But anyway, so that's one of the reasons that people do tend to feel better when they get on hospice early enough. I've always wondered why people on YouTube mess with their hair all the time. Now I know. Because you're like getting a really good view of how bad your hair looks on a bad hair day. Maybe I should just use this instead of mirrors. Okay, anyway, back to the subject. Hospice is one of your rights. You've paid into it. You deserve it. Don't let fear keep you from utilizing it. My suggestion and what I would love to do if I won the lotto and I could just do whatever I wanted um, to work, I would have a job where I was a patient advocate 24/7. And especially these elderly patients, I would go with them to every doctor's appointment and I would want to know, how is this going to add to the quality of life? This medication or this therapy or this treatment, how is it going to add to his or her quality of life? What are the side effects? There's just a whole list of questions that I would give. And at one time I was a nurse navigator. I was an oncology nurse for a number of years, and I worked as a nurse navigator in a cancer center. And that's someone who's basically a patient advocate and an educator. And one of my roles was hospice. And I think the minute that you get that diagnosis of cancer, COPD, emphysema, HIV, anything that could become a terminal disease, you start discussing end of life issues. That scares a lot of people. That just blows their mind. Like, no, 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 no. We're not going to talk about dying. I can't tell you how many times I've heard that. Mama or daddy start trying to talk about, well, this is what I want to do if, and the kids are like, no, mama, don't say that. Don't even say that. Don't talk about dying. It's inevitable. We are all going to die at some time. Let's talk about it, particularly people who have a disease process that makes it a little more possible that it's going to happen. That's what I would want our medical field to be required to do. The minute that there is even the possibility of a terminal disease down the road, you start then planning for that. Because the minute you found out, the doctors have said, look, there's no more chemo, there's no more medications for your lungs, there's no more HIV or kidney, there's nothing else we can do. You are thrown into such a tizzy, you can't think and you can't process, and that is not the time to be making decisions. Your emotions are leading the way, and emotions are the worst decision makers out there. Families are going to do anything and everything they can to keep you here. If that's not your wish, you've got to have an ironclad way to make sure that that's known. And I've got news for you guys. Just writing it down on a piece of paper is not going to do it. You need to sit down and talk to them, get everybody in agreement. This is what I want to do. At this point, I want to stop medical intervention. So, and once again, that's going to be a whole other topic that I plan to go into and give you resources for where to find documentation, what to do, exact A to Z for end of life planning. My husband and I have already done it. I'm going to be 50 in January, but we did this back when we were in our 20s because I've had asthma since I was 12, and I had doctors that actually told my mom I probably wouldn't live to be an adult. So I've always lived with the reality that I could die. My husband is a very healthy man, but we wanted to know that that burden is off our families. We wanted to be in control of what happens to this shell when that soul and spirit is gone. So we did that a long time ago. But on another session, I'm planning to go into A to Z how to plan that. And if you happen to come across this today, I just want you to please, please, please help me out. I'm trying to get the word out. This is my platform that God has laid on my heart to use. So I'm asking you to please give it a thumbs up, subscribe. There's a subscribe button down there with a little bell that will let you know when I upload videos. I'm going to try to do it frequently. Um, I want to give education and information, and I want to get education and information. So I know there are a lot of people out there that know more than I do, so I'm hoping that we can share. So anyway, I hope you have a great day here in Alabama. It is sunny and hot, sticky, and oh my goodness, I'm glad I'm in my car, but it is a beautiful day to be out. So I'm on my way to the care plan meeting because those are important. That's another thing we're going to talk about at another session is being involved in your care plan, whether it's with a doctor or with a nursing home or hospital. You need to be involved in that. That needs to be something you're driving the boat on. So anyway, hope you have a good day. Thumbs up, guys.